We're joined by Dr. Debra Bogen, Pennsylvania Secretary of Health. Now, it's that time of year when people think about COVID and flu and other illnesses. Give us a status of where we are right now.
Sure. Well, it's mid-September, and we're all gearing up for the winter cold and flu respiratory virus season that we enter in earnest, in the next couple of months.
What should people know about current strains of coronavirus?
So the virus has changed over time, which is why the new vaccine is out, because it really addresses the newer strains of the virus that we're seeing in our community. And so the new coronavirus vaccines are now available. Again, with the vaccines, the immunity does wane a bit. And so we encourage people to go get the new COVID vaccines because they address the newer strains that are circulating in our community.
What are the current CDC recommendations for age and complications?
Yeah, the CDC is now recommending everybody 6 months and older get the COVID vaccine. Again, they're available at pharmacies and some doctor's offices. So people should go out and look for them 6 months and older.
So if someone has recently gotten another version of the COVID vaccine, how long should they wait before they get the new one?
At least a couple of months. Again, it would depend a little bit. So I would ask your healthcare provider, in your particular situation. So for instance, one of my relatives just had COVID recently. The recommendation is for that family member to wait about 3 months to get the vaccine.
So once somebody gets the vaccine, how long should they expect that protection to last?
So there's protection, the vaccine is really meant to prevent severe outcomes from the illness, hospitalization, emergency room visits, and of course, death. And so the vaccines, when you first get them for the first couple of months, provide some significant protection around getting sick as well. But what they're really intended to do, and there's longer term benefit for preventing hospitalization and death. So they continue to work, but less well at preventing acute illness. But you're probably going to get a less severe illness, much less severe illness with the vaccine, even beyond those few months.
Now, you often hear people talk about long COVID. What does that mean?
So long COVID is a syndrome that is beginning to be better defined. It really is a syndrome where people's immune system has reacted to the virus and is causing more longer-term symptoms. And the symptoms vary extremely widely. We could have a whole hour-long discussion about what that looks like. There's some very nice information for people on the CDC website about COVID, long COVID, and what the symptoms look like. But it really just means that you don't recover quickly you may actually, some people get better and then get worse again. And again, it's probably the immune system reacting to the virus that you had. And we do know that the vaccines really have some protective effect against long COVID as well.
If someone suspects that they had the symptoms of long COVID, what can they do? Who should they talk to?
They should talk to their healthcare provider. There are some specialty clinics around the state that treat long COVID. And again, we're learning more. There are some research studies also being funded now to really study long COVID. So those are opportunities, both see their healthcare provider, seek one of the clinics that specializes in it, and seek one of the research studies that's really trying to define it so we can treat it better in the future.
Who are the people who are most at risk of getting COVID?
COVID, well, COVID, as you know, really has impacted our older populations. 75 and older account for a significant portion of the deaths and hospitalizations, but really 60 and older and people with immune compromise have worse outcomes. And then actually infants and then pregnant people. Pregnant women really need to think about getting this vaccine and talking to their healthcare provider, because we know compared to non-pregnant people at the same age, they're at much greater risk for bad outcomes from COVID. And the vaccine is very protective. So those would be the groups: older, pregnant, and less than 6 months.
Can you talk about some of the potential risks or side effects of the vaccine?
Sure. Every vaccine we get, the whole point of getting a vaccine is to boost the immune system so that when you see the real thing, your body knows how to react. and to fight that infection quickly. So with a lot of vaccines, you'll have very common side effects: fever, not feeling well for a day or two, body aches, that kind of thing. And that happens with the COVID vaccine as well. But again, those you can treat with an over-the-counter medication, as long as your doctor says that's okay for you, because there are some conditions where those are not recommended. But for most people, a day or two of an over-the-counter fever reliever, pain reliever are good. Again, those are common and be expected. And when I get my side effects from when I get a vaccine and I get a little fever, I said, oh, my immune system's working. It means the vaccine is having the impact I want it to have.
How effective is masking in terms of protecting you from getting COVID?
So we know that masking, there's a couple caveats to masking: properly worn, well-fitting, KN95s, KN94s, those kinds of masks really do prevent spread of respiratory viruses. And not 100%, but they do reduce the risk greatly. So again, for people who have immunocompromised, people who have are particularly at risk, you will see people in the grocery stores still wearing their masks, because we know, especially for people with immunocompromised, that that will help protect them, particularly in crowded places and things like that. I always tell people, outdoors in general, there's good airflow and movement, much less need for a mask than inside. And that was one of the reasons that I always encouraged people during the height of the pandemic to be outside, to be social, to be with your friends. Do it outside. It's much safer.
Where can people get the new vaccine?
So the vaccines are available at a lot of the large chain pharmacies, some of the smaller pharmacies. Some doctors' offices have it. Some clinics have it. I would actually check wherever you're going to go first and see if they have a vaccine for you before you head out.
Are the vaccines free?
It depends they should be mostly free for people, but it depends a little bit on your insurance and your health status. It is covered by the Medicaid program, so 50% of children in Pennsylvania are covered under that health insurance. It is covered under that. It is mostly covered under I'd have to get exactly, it's not always, you say, oh, it's free for everybody, but that's not always the case. The free vaccines that were available through the government have changed, the program has changed. And so you really should check with your healthcare provider before I give you specific details. But for most people, it should be covered, but I can't guarantee that.
If you have the symptoms of COVID or you think you may have it, should you get the vaccine?
So if you're currently ill with the virus, you should get tested. And if you're a high-risk group, the really important reason to test, there's a couple reasons to test. One is to stay home if you're sick, not spread it to others in your home. The other reason is that if you're a high-risk group, there are medications that also benefit people at high risk and reduce their risk of hospitalization and death. And so those medications should be started early. And so you want to test if you're sick. And again, if you're sick, we generally say if you have a fever, in pediatrics, people came in with their children all the time. And if they had a fever, we generally deferred doing the vaccine. If they had a slightly runny nose and mild cold symptoms, we would give the vaccines, childhood vaccines, flu vaccine, but just not usually with a fever.
How reliable are over-the-counter test kits?
I don't have that in front of me at this time. I haven't looked at the data recently on test kits, but in general, the over-the-counter kits are pretty good. Sometimes, until your symptoms get, you may have to do more than one test to find out if you may have to repeat the test, I guess is what I'm saying, in 2 days. So if you get a negative test, but you feel like you have COVID, you can check again in 48 hours and see if it's still negative. I will say that, again, whether you have COVID or flu or RSV, if people can stay home and wait till they're feeling better to go back to work or being out, that will reduce the spread of viral infections in our community. If that's not possible, people, again, I also want to say that you want to get tested because also for flu, we also have treatment for flu for people who are high risk. And so testing allows you to make the best decisions for you and your family and also for your community.
Now, it's also the time of year where people get flu shots. How important is it to get a flu shot?
Yeah, so flu, we've been giving flu shots for many, many years. Flu vaccine is also effective and safe and has been given for years. We get a flu shot every year. We pick what's the strain of the flu virus that's present in the vaccine based on what's circulating around the world, actually, before that. And so it is really helpful and effective. So last year, during the 2023-2024 cold and flu season, about 5,000 people in Pennsylvania died from COVID, and about 500 died from flu. But many more were hospitalized. And so we want to make sure that people have access to both flu and COVID vaccines, because for both of them, they reduce the risk of hospitalization and death. And again, flu is a kind of a tricky virus. It every year, unfortunately, it takes healthy people as well. Generally, it impacts people who have immunocompromised or older more, but with all of these viruses, they can also affect healthy people.
Can you get the flu shot and the COVID vaccine at the same time?
Absolutely. Last year I did that. I got both at the same time. I tend to time my flu vaccine towards the end of October. Every year, that's been my tradition. I get it before Halloween, to be sure. And this year, I am going to get both of mine very soon.
How does the influenza virus spread?
Just like it's a respiratory virus. So just like COVID, flu, and RSV have very overlapping symptoms, and they all spread through respiratory. So sneezing, coughing, talking loudly, shouting increase the distance at which you spread the virus, but it's respiratory spread.
Other than getting the vaccine, what other things can people do to protect themselves?
Again, good air circulation, we know, is one way, both, again, being outside, but in buildings, better air circulation, covering your coughs and sneezes, staying home when you're sick, being, and again, avoiding people who are sick if you can, and if you're immunocompromised and have a particular risk, being even more cautious about crowds and things like that. But for the general public, that's usually not necessary.
What else do you think people should know about some of the viruses around this time of year?
Yeah, so I do want to mention RSV. So respiratory syncytial virus, which is a mouthful we all call RSV. As a pediatrician, we always talked about RSV in the winter because RSV was the #1 cause of hospitalization for infants and young children with respiratory illness. It also affects older people as well. Just like flu and COVID, RSV also impacts older people more. Infants and older people. And so very excitingly, there, for the first time last year, was a vaccine available for, treatment to prevent severe illness in infants and reduce hospitalization and ER visits for RSV for infants and for at-risk children, and then also for older folks. And the effectiveness study, there's been a very nice study showing that vaccine for people 75 and older and even 60 and older reduced hospitalization significantly and emergency department visits in older folks. And in infants, it also protected them from hospitalization. Those are two different products, to be clear. And there's a third product, or the same product that's given to older folks is also given to pregnant people. But it's a unique vaccine because that vaccine is given to pregnant women later in pregnancy, actually to pass that protection onto the baby. So we don't do that for other vaccines, although flu has some benefit as well in the same way. So very exciting for me as a pediatrician to see this vaccine available because it really will change the course of hospitalizations for children who cough and wheeze and get very sick with something we call bronchiolitis in infancy caused by RSV.
We've been speaking with Dr. Debra Bogen, Pennsylvania Secretary of Health. Thank you for joining me.
Thank you so much for having me.